In nursing education, theory and practice are not separate paths, but interconnected foundations that shape competent and safe patient care. Before students enter clinical duty, a strong theoretical background is essential to guide their decision making and ensure that concepts learned in the classroom are applied in real hospital settings. Good day, everyone. We are students from BSN 3A Group 1A. I am Julia Maridi Acosta, and together with me are Danish Keyaan A. Aquino, Jason Matthew C. Blanca, Mishy B. Bonsato, and Jayden L. Buencochillo. We are presenting the poster of our study, The Levels of Attitudes in Theoretical and Practical Learning Approaches in Nursing Education Among Students. This study is focused on levels 2, 3, and 4 nursing students in a university in the Philippines, studying their levels of attitude towards theory and practice, addressing the lack of local research. Findings aim to support a student-centered curriculum that aligns with learning preferences and strengthens both academic and clinical performances.
For research design, this research utilizes a quantitative descriptive research design, which is the measurement and quantification of traits of a population in presenting an objective description of the level of attitudes towards theoretical and practical learning approaches of nursing students. For study sample, using the probability sampling technique, specifically stratified random sampling, 254 participants were determined. Sloven's formula was used with 5% margin of error. Participants were selected by fixed interval. Level 2 is 100, Level 3 86, Level 4 68. For instruments, Part 1 demographic profile of the participants, Pullman measured levels of attitudes toward theoretical learning. Standardized instrument with permission to use from author, 0.931 convex alpha. For Sultan et al., measured levels of attitude towards practical learning. Researcher made, validated by 3 clinical instructors using the Good and Skates criteria, and pilot tested to 30 participants. 4.8 validity score and 0.9 reliability score.
And for our results and discussion, for our demographic profile of 254 students, a slight female majority is shown, consistent with studies, 52% female and 45% male. And for our year level, most students were level 2, 39.4%, followed by level 3 and level 4, 33.9% and 26.8% respectively.
We will now proceed with the levels of attitudes of nursing students when taken as a whole and when grouped according to sex and year level. For the practical learning, sex, both male and female nursing students show a favorable attitude with minimal differences between sexes. And as for the year level, lower levels may show a more enthusiasm, while higher levels face greater academic and clinical pressures. For the theoretical learning, for sex, male and female students both show a favorable attitude. And as for the year level, some year level find it less engaging. However, all year levels agrees that this is a foundation for their clinical skills. Next is the difference in the levels of attitudes of nursing students when taken as a whole and when grouped according to sex and year level. First is the practical learning. Sex, there is no significant difference. As for the year level, there is a significant difference. Despite differences, all year levels still show a positive attitude. As for theoretical learning, there is no significant difference when it comes to sex, and there is a significant difference for year level.
Now we will move on to the post-Hockman Whitney U test in the levels of attitudes of nursing students. When taken as a whole and when grouped according to sex and year level. For practical learning, levels 2 and 3, significant difference. Levels 2 and 4, significant difference with higher attitudes in level 4. Lastly, levels 3 and levels 4, no significant difference. For the theoretical learning, no significant difference between levels 2 and 3. Next is no significant difference between levels 3 and 4. Lastly, there is a significant difference between levels 2 and level 4. Now we will move on to the conclusion. The study found that nursing students generally have a positive attitude toward both theoretical and practical learning, regardless of sex. Learning attitudes evolve as students progress through year levels, adapting to more complex academic and clinical environments. All in all, the institution where the study was conducted offers satisfactory theoretical foundation to students which they use well in practice, showing positive attitudes towards theoretical and practical learning. Now for the recommendations, first is for university administrators, enhance curriculum balance between theory and clinical practice, support faculty training, simulation, and clinical partnerships. For clinical instructors, use engaging, reflective, and behavior-based teaching methods. Next is to promote hands-on clinical learning and simulation-based practice. For nursing students, build a theoretical foundation through videos, readings, and lectures. Next is to prioritize hands-on competency through skills lab, return demonstration, and hospital rotations. Lastly, for future researchers, expand the study to multiple universities to compare different curricula. Now we will move on for the references. You can just scan the QR code at the side.